A very warm welcome, everyone. I, Dr. Nishant Sharma, on behalf of Voice of Healthcare, thank you all for joining us today as we pay tribute to the exceptional healthcare professionals who tirelessly look after our well-being day and night. Voice of Healthcare, along with our supporting partner Apollo Hospital, has taken this initiative to recognize National Doctors Day through our video series Know Your Doctor. Through these series, we aim to showcase the diversified interests and passions of our esteemed doctors. On this National Doctors Day, let us express our gratitude towards these extraordinary individuals. So to start with the introduction, I welcome Dr. Sucheta, Senior Consultant Neurology at Apollo Hospital. A very warm welcome to you, ma'am.
Thank you so much.
And I wish you a very happy Doctors Day.
Thank you. Thank you so much.
Yes. So to start with the series of questions, I hope you're ready. The first question is, so do you have any interesting stories or experiences from your medical career that have deeply influenced the perspective you have on patient care and the practice of medicine in general?
Oh, yes. Over last 35 years that I have been practicing as neurologist, I've dealt with so many patients, and still some patients really stand out, and I remember. And many of them are more for the contribution made by their families and how much they helped the patient to come out. And even those patients I remember who had a terminal illness, and despite that, the family was so good that even after their demise, I still have very good relations with the family. So we literally share the suffering with the patient's relatives sometimes, because in neurology, there are many disorders that are going on for so much longer time. Sometimes for years, patients are having issues and all. And still, even young patients, right, small children. I remember my 10-year-old GPS patient who could not move any of the part of the body except her eyes. And she has grown, and she is a very well-known doctor in Delhi now. So I'm so proud of her. Similarly, there are so many others. There is a family from Bhilwara. The patient was on ventilator for 3 months, and he was there in Apollo for 7 months and recovered very well and went home. And all this because we get to know the family also along during the patient's journey as well. So apart from our efforts, when the relatives are also very helpful and accommodating, it makes a huge difference, a huge positive note for the patient.
Right. So I think what you're trying to explain here is the part the positive psychology and empathy plays in the journey that goes through a patient.
Yes.
Right. All right, ma'am. Moving on to the second question. So are there any particular medical advancements or technologies that you find intriguing and you believe that in the coming picture, they are going to make a big role?
Oh, yes. I think since the time when I did my DM neurology in 88, things have changed so much in all the fields, literally. And the huge step was the investigation part, as we have so many MRIs and PET scan and SPECT and so many other things. Similarly, even in stroke, earlier we could not do anything except the conservative treatment. And now we have such good treatment. We have not only IV injections that help us dissolve the clot that causes blockage of blood vessels to the brain. We also have mechanical thrombectomy where the clot can be sucked out, can be removed, and blood supply can be restored. And patients become well right in front of our eyes, which is very exciting. The patient who has come with zero power is not able to speak, and just after treatment, he starts moving and is completely normal, sent home in 3-4 days' time. I think that is phenomenal. Particularly, even for epilepsy, we had very few medicines earlier. Now it's not only medicines, but also we have epilepsy surgery that is showing great results. And even in movement disorders, Parkinson's disease was the only thing that we treated really, and we didn't have much treatment for other types of movement disorders, the dystonias and all. And now with Botox therapy available, things are looking better, and also surgeries now for that, DBS surgery and all is, it's very exciting. There is going to be, and genetics also is a huge role
Mhm.
for further improvement. I see a lot of things happening over next 10 years.
That is really a very resourceful conversation. So moving on to the last question, this is more of a personal question. So on this National Doctors Day, what is the kind message that you would like to give to all your fellow doctors, all the medical fraternity who's serving the nation?
Same practice as I am doing, that we are here basically to help patients.
Hmm.
And empathy is something which is so important in our practice. We need to understand not only patient suffering, but even the relatives sometimes. They also need to be, sometimes they get angry, but it is understandable because it's somebody near to them who is suffering. So I always feel that it's best to do your best, and then try to understand what the patient or the relatives also want. Try to help them out, and your empathy is going to come through. And when you are true to yourself and to your work, it will show in your practice.
Hmm. It's lovely about hearing all of these things. So, with this, I would like to end the session, and I would like to thank you and thank all the doctors who've been selflessly serving our nation's health. So, together, let's salute your dedication, their dedication, the compassion, the unwavering commitment to our health. So, I thank you and I thank all the doctors out there.
Thank you so much. Very nice.
Yeah.